Central New York is on the verge of getting the kind of cutting-edge investigative medical treatments and therapies you usually find in distant academic or institutional medical centers. Joining me now, three guests: Dr. Jason Stepkovitch, Dr. Khatuna Stepkovitch, and Kristen Stebbins. She is the VP of Operations at iCor Research here in Syracuse. Thank you all for coming in. Really appreciate it.
Thanks for having us.
So Kristen, let's start with you. The first question, simply put, what is research as a care option? That's kind of the name we give to this kind of thing, right? What does that mean?
That's right. So research as a care option means providing research as an option for patients as part of their standard medical care. So if an individual potentially qualifies for a clinical trial, their doctor can discuss it with them as one of their options for treatment. And it can result in them being able to take new therapies, have better monitoring of their health conditions, and help advance medicine for future patients.
Khatuna, I'm curious from a doctor's standpoint, how does this all work in your relationship with iCor? What's the partnership and how does this all work?
So I think to be trained in research and to understand the research better, it's very important for every doctor. So it makes you, I think, a better doctor, and it gives you a chance to take more holistic care of the patient. So having opportunity to offer patients something beyond standard treatment, especially in case when for that condition standard treatment is very limited, I think it's very exciting, of course, for the patient, but also for the physician.
Yeah. Jason, where would you say we typically find the biggest gaps, I'm not sure, however you want to kind of phrase it, between what's offered now and this kind of advanced clinical, investigative kind of treatments and therapies?
Well, Khatuna is a specialist in geriatric medicine. I'm a psychiatrist. Geriatrics, of course, heavily focused on neurocognitive disorders like Alzheimer's disease, where there's significant limitations and treatment, standard treatment options. Being a psychiatrist, major depressive disorder, anxiety disorders afflicting millions of people. In the case of depression, approximately 30 to 40% of individuals just don't respond well to standard treatments like SSRI therapy. So our clinic had already had an interest in participating and making available to the community what I would consider like cutting edge treatments, and to be able to get involved in clinical research trials for the community and for our patients has been an amazing opportunity.
Yeah, Khatuna, I think as far as I understand, you have all been already utilizing this. So as best you can, how has it been working? How's it been going?
I think it's been going very well. For the patient, it's very important for, especially if they have a good relationship with their primary care doctor, to be able to discuss the options of research, the research study, to participate in there with the doctor they trust. So, and for me, it's, I feel much more comfortable to refer patient to the trial when I know exactly what it entails.
Yeah, Kristen, obviously two-way street here, so John and Khatuna will be, I guess, what they call clinical trial investigators. What does that mean, and how do you work with them to kind of bring them into maybe the research that you have already been doing for some time, you and your team, obviously?
Yeah, that's right. So as the Dr. Stepkovitch are expanding their role to become clinical trial investigators, not only are they caring for patients with standard medical care, but they're also serving as the overseers and the leaders of some of our clinical research trials. So that means they're evaluating patients for eligibility, they're making sure the research is being run safely and ethically, collecting study data, and getting firsthand experience with those new therapies and new medications. The main idea here is that we're bringing research directly into the community where patients are already receiving care, and it's very easy to offer the trial to them as an option for their care.
Jason, maybe time for one last one. Besides just simple access to this kind of treatment and therapies, are there other advantages to offering this to patients?
Yeah, absolutely. I mean, I think as a physician, it's important for patients to bear in mind that literally every medication that we take started with a clinical trial, right? So, for our patients that choose to participate in these clinical trials, not only are they perhaps benefiting personally, but they're also giving back to the entirety of the medical system, right? So, I just see it as a wonderful opportunity. We're super excited to be participating in this. Hopefully it's something we're going to continue to utilize and grow with. We're tickled that ICOR, honored us by partnering with us. So, yeah, can't say enough about this.
Yeah, it's great stuff, and I really appreciate the three of you coming in and sharing. Certainly exciting stuff. So thank you very much, and I'm guessing we'll probably check back in with you at another time. Thank you for being here.
Thanks, John.
Thank you.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.